Hello everyone and welcome to Dementia Researcher Showcase. I'm Adam Smith from Dementia Researcher, and as ever you're stuck with me today. But today we're going to be asking what the UK can learn from Japan about technology and dementia care, and how tools such as robotics, virtual reality, smart homes and AI might support people living with dementia. We're joined by Dr. Bethany Linder from Nuffield Department of Primary Care Health Services at the University of Oxford. Hi Bethany.
Hi. Sort
Some
of
of
right. I'm at the Department of Psychiatry now.
I'm so sorry, and you did just tell me that as well just before we were speaking. I apologize. For those that don't know Bethany, go back, have a look back a couple of years ago. Bethany was a regular blogger on the website and has contributed to the salon before as well. But today Bethany is going to be sharing insights from her Churchill Fellowship, where she visited Japan to explore how one of the world's fastest aging populations is using technology in dementia care. So over the next 45 minutes, we'll hear about what she has been working on, what's worked, what hasn't, what lessons could be useful for research and care here in the UK. And there'll also be lots of time for questions as well. So you can ask questions at any time using the Q&A button, the little question mark with a square around it. If you're in the app, I think you might have to tap the tab at the top. And if you really can't work out how that does, use the comments. But you can post those at any time. But that's enough from me, I suspect. Bethany, would you like to share your screen? I'll stick around while you share your screen. Make sure that works.
We all
We
we all
tested
good?
this. It did work.
Can you see it?
We can. So
Yeah.
over to you, Bethany. Thank you.
Well, first of all, thank you so much for having me, and thanks for the intro, Adam. Sorry that I made fun of you for not getting it completely factually correct, but I love the delivery. And thank you for everyone for coming today. I'm Bethany Linder, and I'll be talking today about my Churchill Fellowship project that I did in Japan and Hong Kong about technology for dementia. So the aim of the project was to investigate how technology and three different types of technology can be used to support older people and people living with dementia, and to have a think about what worked and what didn't, and how it could potentially be implemented here in the UK. So here's where I can thank all of the people, the very lovely people who let me visit their labs and organizations. I was very, very touched by how willing people were to let me in and ask a million questions. So I was there for 2 months in all. I started in Osaka, had a week in Hong Kong, and then spent the rest of the time in Tokyo. And I investigated 3 different types of technology, and these will be written up as a report, but within 3 sections: VR, smart home and wearables, and stealing a term that they use all the time in Hong Kong, gerontech, and then the final section, robots. So the first thing I looked into was VR and the applications it can have for older people. This is, by the way, a stop tour. So I've put like little references to places you can look up and read more about it if you're interested. But yeah, my first stop was Dr. Miyazaki at RCAST, who was using VR as a rehabilitation tool in speech and language therapy. So she's created some games that people can use, and the advantages of this is that through gamifying, the rehabilitation is more fun and it's a great motivator. And critically, it can be done at home on your own. So there's a cost and convenience benefit as well. The second thing that I looked into was the VR travel project. So using VR as a sort of relaxation and well-being tool. Mm-hmm. So the VR project sprung up during COVID, when no one could travel, but people in care homes were getting quite distressed because they were not able to leave or receive visitors. So they set up these travel clubs where they explored places in Japan using VR, and it was really beneficial for well-being. And they're still running today. So they can also be used as a reminiscence tool if you set up an environment that's sort of historical or so from their youth. This can have benefits too. And then finally, I looked into Silverwood's VR angle shift project. So Silverwood is a care home chain, so they have lots of care homes across Japan. And they worked with people living with dementia to co-create a VR awareness tool that recreates some of the scenarios, like difficult situations people with dementia experience. So one that really stuck out for me was they worked with someone with young onset dementia who gets lost frequently and needs to ask for help. But because they look younger, people are quite confused by them. They don't present as an older person where you might suspect they had dementia. So you got to live out a recreation of the anxiety they feel about asking for help. And by experiencing it from your own perspective, it really brings the point home. So they use that to train mainly healthcare professionals to hopefully improve their dementia awareness and empathy. So VR is becoming way cheaper and easier to use. I remember when it first came out, you needed like a really super amazing computer, and the headset was super heavy, and you might have to attach it from the ceiling. But that's not the case anymore. You can get sets for like £300. They don't need a computer; they just run on their own, and you can chuck them in the bag. So they're very portable. So, and they're also more user friendly. You can just download things from an app store instead of having to like create tools or install tools. Despite this, there are still barriers. So it's becoming way more viable to use things like this in dementia care, but it's still not super easy to use. Like, it's still a new technology that someone's going to have to use. And for people who aren't very tech proficient, or they have difficulties using technology because of dementia, they would probably need quite a lot of support to use it successfully. So the idea is that it would take off the pressure of therapists or people that do cognitive stimulation and let people do it in their own homes. But in reality, it might not be possible. So I suppose the future direction here is to investigate how we can make it as user-friendly as possible. And for those who get motion sickness, identify who it is that tends to struggle with motion sickness or feeling disoriented from VR, and figure out who it's suitable for and who it's not. The second section was about smart homes and wearables. So we actually do have a lot of this stuff in the UK already. Things like monitors and sensors in people's home to let them live independently at home for longer. So you can have things like a sensor in someone's bed that can learn their routine, so it can tell if they're in bed or not. So if there's an older person that gets up on the dot every day at 8 a.m. and then the sensor tells you next that they go and turn on their kettle for a cup of tea, and then one day it's 1 a.m. and 1 p.m. and they can tell that they've not got out of bed yet and they've not turned on the kettle yet, that would trigger someone to go check that they're okay. Also, things like alerting for falls as well. If you can use that AI to make sure that they're okay at all times, rather than having to rely on pressing a button for an alarm, because if you fall in a way that you can't reach an alarm, you need some way to trigger that. Also, medication managers, little robots that dispense your pills once a day or however many times a day and set off an alarm or a reminder. Those are also things that can really help people live independently. And then lastly, mobility support. So smartwatches that can track you and maybe help direct you back to home if they think you might have got a bit lost, or alert a caregiver if you have got lost. I looked at things like smart canes and walking frames that can help with mobility and standing. And then lastly, a bit quirky, but an exoskeleton that you can wear. You've got my husband demonstrating the exoskeleton at Cyberdyne in the picture. That supports your back and your hips so that you can lift heavier things and you can stand up and sit down easily, which is a big problem for some old people. I also tried out a wearable exoskeleton arm that strengthens your arm. That should make it so you can throw a ball further and score more points in basketball. But we all sat there for what felt like a really, really long time, as even with the arm, I missed shot after shot after shot. So there are limitations. They're not perfect right now, but hopefully one day we'll see mech suit grannies everywhere, and I certainly hope that I can see that when I'm older. But there are barriers to gerontech. Firstly, education and awareness. This is a big one. Most people just don't know what's available, where to get it, and how to use it. The second one is cost. Some of these things that we're seeing were hugely expensive and just out of the budget for most people. And you have no opportunity to try it out and see if it works. So you could get your grandma a medications dispenser or a fancy dementia phone, and then she just refuses to use it, and then you've wasted a bunch of money. So something needs to be done about that. And lastly, this one surprised me a little bit, but one of the biggest barriers is social stigma. So people just don't like the concept of being saddled with gerontech because it makes them feel old or it makes them feel vulnerable. So another future direction is finding ways that we can make gerontech more appealing, whether it's aesthetically appealing, implemented in a way that sort of ties into what they're already used to, like an update to a technology that they already use, and just implementing things more thoughtfully. So for me, I went to this elderly research center in Hong Kong, and for me, this really tackles all of those barriers if we could have something similar to this in the UK. So firstly, awareness and education. This is a site where they have model homes that have got a bunch of tech integrated into them, and anyone can book a tour. So like a family with an older person, a care worker, a care home health professional, and they can look at these smart homes and have a think about what they need and how they could integrate that themselves. In terms of cost, they have rental services. They have try before you buy things, so you can if you see something in there that you think might be useful, they can set up a system for you to try it out before you have to buy it and invest in that way. And they also, this is what really impressed me, they try to find wherever they could like low cost solutions. You don't need a super techie robot to do something that like something you might already have in your home could just be adapted a little bit. So those model homes were, tiny, like normal size for Hong Kong, but really tiny by UK standards. And they were very realistic, showing you things that could be adapted in your own home without having to buy things that are new. For example, in that picture, they've got a wardrobe. So he was talking about how if you have something, a cupboard that you want someone with dementia to know what's inside, just replace the doors with something see-through. And likewise, if there's something that you don't want them to be messing with all the time, make sure the door's opaque and maybe paint the handle the same color so it's not drawing their attention. Or, add tape, colorful tape to things you do want them to interact with. So they give you lots of ideas about how you can do things subtly, which is, tackling that sort of stigma element again, and cheaply. And and they had a real focus on design. So they were trying to make things feel homely and natural, so it wouldn't feel jarring. So people would be more likely to accept the technology. And they also had a co-creation living lab. So they invite people with lived experience in and help them work with companies that develop these kind of technologies to make sure that the technology is actually meeting their needs and what they want, as well as like taking into account what their worries are and what the barriers are, so that hopefully technology can be a bit more tailored to the population that needs it. And finally, robotics. So in Japan, in Hong Kong, in the UK, there's massive carer shortages. This is a huge problem, and there's been a lot of discussion about how robots could maybe like ease the burden of carers a little bit, taking on some of their tasks. So I looked at 3 different types of robots while I was there. Communication robots, so robots that you can chat to, they can help people feel less lonely, they can give them advice. Pet type robots that likewise make people feel less lonely, but they can also be very calming and soothing, sort of similar to like a therapy animal without all of the challenges that come with looking after a real life living animal. And then finally telepresence, which is it's like a robot Zoom call situation. So you're inside the robot and you can move around in the world and talk to people that way for people who can't leave their house for whatever reason. So these are some of the robots that I got to see. It was so fun. So on the left column, that's the talking type robots. The robot there on the desk is Sota, who's very, very polite. And when he found out I was from Manchester, he did a little rap about Vimto in Manchester, which was an experience. But I was thinking, this whole project was, the reason I wanted to do it was because I was inspired by my grandma. She passed away earlier this year. She was 97, lived with dementia, very severe anxiety and loneliness problems. And she had, 7 kids coming in and looking after her, and as well as professional carers coming in. But as soon as you left the room to make a cup of tea or go to the toilet, she was crying, so anxious. She thought she'd been abandoned and that she'd been alone for hours. So she needed someone to be in her eye line 24 hours a day, which is really, really challenging. And not, most people don't have 7 kids. So it's not possible for a lot of people. So if you could have a robot there that can ease their anxiety, make sure that they're oriented and then they know they're safe, that could be so valuable, I think. The middle row is the pet type robots. The one at the top, Lovart, is so cute. I couldn't put a video on this, but Google it afterwards. It is the most adorable thing. Then there's Mouflin at Casio, Paro, who's like the OG dementia robot. He's been around since the 90s. And Aka-chan, Hiro-chan, who's a baby with no face, which I found a bit creepy, but apparently that reduces agitation. They find the face quite annoying. So that cries and you have to look after it, and it sort of awakens sort of a caring instinct that people have automatically. So that's quite useful in care homes. And then finally, telepresence. I'm running a little bit behind, but at the bottom there's Professor Ishiguro, who made a robot twin of himself so that he can give lectures without having to go down there. And then above that is Ori Labs robots, who they help disabled people have jobs by working as a waiter, that they remotely control the robot in this cafe and bring the drinks, and working as a remote robot tour guide. And neither of those are dementia oriented, but I definitely see the applications they can have for all the people who have mobility issues, who maybe struggle to get out of the house, because they offer a way of getting connection. And social interaction is so important in dementia for well-being, for slowing the progression of dementia and for preventing dementia. So if we can use technology to prevent social isolation in older people, I think that could be hugely helpful. In terms of barriers, the main one is the cost. They're so expensive. Can I go back? Yeah. Sota, the little blue robot, he's £1,000. Lovot, 3,000. Paro, bougie, he's £6,000. That's out of budget for most people. And when a lot of care homes or NHS trusts are struggling already, you really need to have strong evidence to justify the cost. It might be worth it in some situations, but it is a huge barrier. So we have to hope the robot costs come down. And also, it's the main benefit of a robot is to theoretically reduce the burden on staff and carers. But these robots can be quite difficult to use, and things can go wrong. This guy, he's a rehabilitation center, and he cheers on the older people and they love him. But he can get into some situations where he's trapped somewhere and he can't get back to his charger. He was causing havoc. So even though he's meant to reduce the burden, he did actually take up a lot of staff time making sure that he's all right. And you have to be quite tech proficient to use it. So that's taken up more of the staff's time to have to learn how to use these technologies when they want to just be getting on with their job. So there are implementation challenges, but I think there's huge potential for improving social isolation and really taking some of the burden off of carers if those things can be addressed. In terms of future directions, I didn't touch on humanoid robots at all in this project. because right now they can only be remotely piloted and they're very slow. I don't think anytime soon we're going to see robot carers or robot healthcare workers because they simply can't work on their own. But maybe in the future, this could be really cool. I also went to other places. Well, I don't have time to talk about it, but it will be in my YouTube series. And I got to try on this cool suit. So yeah, sorry for running slightly over, but thank you so much for listening, and thank you to Churchill Fellowship for funding this project. It was the trip of a lifetime. It was so interesting, and thank you to GB Sasakawa Foundation for giving me some extra funding to let me record the whole thing as a YouTube video series. So that's my YouTube channel. It's not up yet, but you can go and subscribe in advance so that you don't miss it when it comes out. If you search Bethany Linder on YouTube, the first thing that comes up is a lady that does contemporary Christian rock covers. That's not me. So just keep scrolling and find me. And thank you very much for listening. Thank you for coming, and I'm open to any questions.
Thank you, Bethany. That was brilliant. Really, I'm. Although you've completely stolen my first question, which was about implementation, because I've got some relatives who are a little bit older who have had things done like handrails on stairs and showers that they can sit in, and and even getting those very basic essentials to prevent falls seem to only come after they'd had a fall, there was a problem, and then it was the local authority in I'm in the UK, obviously, Age UK that stepped in and arranged all this and gave this support. Where do you think delivery of things like this will fall? I mean, do you see this as being a social care thing, an NHS thing, or certainly those more affordable elements you were talking about?
For sure. Like even like in my own family's experience, it was so hard to get like a stair lift put into my grandma's house by the time that it was in. She was too frail to use it. So things comes up in my research all the time. There needs to be a clearer pathway. It needs to be easier for families so that they're not fighting every step of the way to try and get things in. In terms of technology, I just think we should have one of those aging, like elderly resource centers. Even if we could just have one in London as a trial and see if people respond to that. There needs to be a way for people to even find out that it's possible. That's the biggest burden. I mean, that's the biggest barrier. And then in terms of if we could train up the occupational therapists that are coming in when the council's putting in the handrails and be like, well, have you thought about these like tracking things, these monitoring things? If that could be implemented in that stage, that could be a huge help, I think.
Yeah. I can see that, because of course if this was a treatment, which these kind of, I mean, I know they're not treatments, but if this was a treatment, in the UK and other parts of the world, you've got regulators, you've got government bodies that are there to evaluate the costs and the benefits and then make recommendations to people. You kind of almost feel like you need that same. Maybe it already exists and I'm just naive to it. I don't know if anybody online knows that. Are you aware, Bethany, of anybody who's taking a lead on that kind of evaluation and recommendation side?
In the UK, I don't know, but in Japan they have sort of regulatory group that tests out this tech stuff. And I spoke to a researcher who's compiling sort of a database where you can click on like an issue that you're having, like there's an issue with falls, and then it'll bring up sort of the technology that could help and the evidence base around that. So I think I'm not sure what's available in the UK, and that's kind of the problem. Like we don't know how it works. So if we can have a more robust system and improve awareness in everyone, then
and that would be
implemented.
That'd help everywhere. I mean, not just people living with dementia, but I mean, people are just older and frailer and other things anyway. So there's always going to be those tech bits, but then there's practical. I can see how somebody like the Royal College of Physiotherapists or occupational therapists or others would be good partners that work. Well, that's your next grant application. Right, let's take some of the questions. Thank you very much for being patient. Do use the Q&A to post those. Were there any technologies to assessing dietary needs?
In terms of eating, there was some like in the Elderly Resource Center, I remember there was some like plates and forks and knives that were like easier to use for some people that struggle with like holding silverware. I don't know about assessing diet. Like I'm not sure what you mean. I don't know.
Well, I guess,
in the chat?
I mean, I suppose it's about assessing these. Obviously, a lot of what I've seen, you know, like cups that will remind you when you've not had a drink and things like that. They don't underlie, they don't kind of assess underneath. Is this person? Are we seeing that in, I guess, looking at calorie intakes and whether you're getting the right? You can see how that would be useful anyway. Is, has somebody eaten enough today? Have they eaten the right kinds of foods today? So you've not come across any tech like that while you were on your trip?
I don't think so. Just reminders,
Okay.
like what you said, like reminders to drink and such.
Yeah. So sorry, Yingli. No, but if you've come across any, let us know in the chat. Next question. Did you see any evidence that these technologies were improving outcomes for people living with dementia, or were most examples relying on anecdotal feedback, acceptability, and feasibility?
Yeah, for sure. For almost all of them, some of the things that were like early stages in development, it was more small pilot studies. But for example, like the Paro robot, the seal, that is one of the most tested robots. I would think the strongest evidence around Paro, and there's been, cost benefit analysis, like a bunch of studies about how it can improve agitation and reduce the amount of like medications people need because they don't need psychiatric medicines anymore. So yeah, there's a lot of evidence. It was hard for me to like summarize everything in this, but if you have any specific questions, I can like send you some literature if helpful.
Thank you. Next one. Thank you so much for your great talk. Look forward to the YouTube channel. You mentioned a few times about financial constraint. I wonder what your thoughts are on how these technology advances might impact on dementia inequalities, particularly in the UK.
Yeah, for sure. I mean, as a researcher, I've been to care homes that are like very underfunded and some that are like so fancy I kind of want to move in myself. So I can imagine like there's one care home I'm thinking of particularly, like if they found out about all these paros and stuff, I think they'd be buying them with no issues at all. But for ones where they're really struggling, it's even further out of reach. So I mean, I don't know how to solve that problem, but yeah, we could be in a future where like the very wealthy have care homes that have full of robot carers and they're attended to every second of the day. Or it could be that like it turns out that's the cheaper thing and that's what the poor people have and the rich people have real people because they like that more. Do you know what I mean? It's hard to say, but yeah, it's sad.
Yeah. I mean, well, we're having the same conversations right now, aren't we, about, you know, doing medications of stuff, particularly those that aren't available on the NHS, and then we get this postcode lottery even then, where some social care services will fund these things and others won't. Which is was there a single kind of affordable, smaller technology that you immediately thought, that's easy, we should, you know, that's an obvious one, that's easy, we should grab that?
Well, I think it really depends on what people struggle with, doesn't it? So some of those monitors are very, very affordable. But if someone doesn't have a problem with like wandering and getting lost, then you don't need them. The cheapest robot was Mouflin. That was only £300. But then again, it's cheaper because it doesn't do as much and there's not an evidence base around it. So like there are really affordable pet robots that you can even get on like TikTok shop that I see advertised. I don't know how many of those, when you get them, look like the pictures, but
Yeah.
it depends on what people are looking for. But there are definitely affordable things or knockoff versions, dollar store
Some
versions.
some of the easier things seem to be where an existing technology is repurposed, doesn't it? Where we've already got something, which is, smartwatches didn't come about to help us manage, problems living with dementia or problems with aging, but we've found lots of ways to squeeze more technology into something that's become accepted or to make use of what's already there. Were there any technologies you saw that are already, readily available, repurposing uses of, I don't know, I'm gonna not say Alexa because she'll reply, things like that.
I was thinking of her as well. For people with like PCA, particularly, Alexa can be so helpful, and you've just got to be clever about how you put it about. I'm trying to think of anything that was.
I was wondering whether there was, softwares or apps or other
Mm.
devices that you came across that you think are underutilized potentially.
So something I was talking about with, I can't remember the researcher, but they were talking about, how you can have like I think people call them like dumb phones, where you turn your smartphone into a dumb phone so that you can't look at TikTok for 8 hours a day. They were talking about if you could do something similar where you turn it into a sort of dementia friendly mode. So if you can figure out what it is that people struggle with using their phone, because it can be quite complicated to use a smartphone. If we can just apply that dementia friendly mode to it that they already have, excellent. But
Yeah.
also, the elderly resource center had like the idea of just putting white tape over things. Like if people really struggle with like their really complicated phone or computer, just like tape over the areas that they don't really need to look at. They had a washing machine where they taped over all the complicated stuff and they just have the on button. Like, it can just, you don't have to reinvent the wheel sometimes. I thought that was really
Yeah.
interesting.
You could see that, and I think a guide, some kind of guide to how some of those other devices can be, because we know Apple are forever coming up with different assistive adaptations in their software. But if you don't know it's there and you don't know how to turn it on, or you don't know how to use it, or if you've got an Alexa, unless somebody's giving you the guidance on some of the things it can do that you could use, you can see how just having some of those, which would be completely free. I've got an elderly relative who's fallen over a lot, and the first thing and then didn't have a phone and has sat on the floor for hours. The first thing I did was go put an Alexa in there and then hook it up, make sure it had the phone numbers so they could at least shout, and Alexa would answer and phone somebody, and that there was a lockbox next to the front door so somebody could then get into the house, which seemed like, but I knew to do that. I guess not everybody would. Let's take some more questions. Sorry, you're all been very patient. Thanks for the overview, Bethany. Sounds like a fascinating trip. Knowing that younger people can develop dementia too, did you see any evidence of technology being utilized, for example, to help those with dementia in employment or helping carers balance employment and caring?
Yeah, for sure. The telepresence robots. So the ones that you could remotely control so that you can take part in work from home. I definitely thought of that as like being a way of helping people to work. But I didn't get to it. I can share my screen briefly again if that's okay.
Yeah, go for it.
So that's not in slideshow mode. Okay. I went to two places where this was not technology related, but they were work programs for people with dementia. So there was a care home that has a sweet shop inside it. So when the residents want to work or want to have a little bit of connection with people, they can go and man the sweet shop. And that was a really beautiful thing to see. Like people in the community were going in and out of the care home all the time. It didn't feel like, I know some people can like feel a bit scared about going to a care home. They think it's a sad place, but like there was constantly things going on and people had real meaning in taking part in some work. And here is the Orange Day Cafe, which is a cafe where it's called the Cafe of Mistaken Orders, where all the waiters have dementia, and sometimes you get the wrong thing or a bit slower than you think. But everyone that's in there is a bit more understanding about the additional needs of the waiters. So I'm making one of the episodes of the video series is going to be about work and dementia, and yeah, I hope that people enjoy it, because it is so important. This in my research, when I talk to people living with dementia, something that does come up, especially for those people with young onset dementia, is the impact that a diagnosis of dementia has on them when they have to finish work. They have to retire earlier than they thought, and a big part of them has changed, and the value that they get from and meaning they get from work. So I'm hoping that video will be a good summary of that. Yeah, I don't know if that answers your question. I feel very passionate about this issue.
I think you did. Thank you, Rachel, for that question. I mean, that's where I think things like I saw one of those projects. I can't remember if it was an Alzheimer's Society innovation project or if it was from the big competition that they ran. Can't remember the name of it, where they had the augmented reality glasses that would potentially do things like overlay a stovetop and make it colorful and flash to show that this is hot or this is where things are, which would be, unobtrusive. You could wear glasses. We've already seen Meta produce glasses like this, where some kind of augmented reality glasses that would pop up messages or do things have some real potential for that.
Yeah, I mean, ultimately, when people derive so much of their self-esteem from work, and they just need a little bit of extra support, just do things a little bit differently. And whether that is technology or just being more accepting, there's definitely things people can do to support people for working if that's what they want to do. So
well, and that's where I think there's a lot of things already out there that just aren't necessarily utilized in the same way, or rethinking how we use existing tech. It doesn't necessarily need to be something brand new, does it? I'm thinking about things like, of course, we've had them on the show a few times. Zeke Steer will be very happy that I give him a plug, but the Milbotics Smart Socks, which I saw today, has just been given some more Innovate UK funding to put a full research program with Queen Mary. Where Byron creases, is that Brunel?
Sure.
Brunel, to look at evaluating that, where you've got socks that can help carers manage agitation because they've got all these sensors in them and researchers to collect data. They've got a website, milbotics.com. Have a look. Right, let's take another question. We've got loads. Thank you for the presentation. It was very interesting. Just to ask, what does the future of AI in healthcare look like? What points do you think key themes should be to focus in AI in healthcare?
Yeah, so this project, I didn't look at so much AI actually, but I just finished a paper about AI in medication reviews, which I'll be presenting as a poster at AAIC in a few days. So yeah, so my research project was about people's sort of perceptions of AI in healthcare. What are they worried about? What do they think would be helpful about it? And obviously, you need really, really rigorous testing to make sure things aren't hallucinating and giving people the wrong medication based on like hallucinated medical records. But I think that the thing that came across most strongly was that people are not happy with the healthcare they're getting at the moment. They feel rushed out of the door every time they see the GP. They feel like they have to battle a titan, aka the GP receptionist, to even get an appointment, and it might be over the phone. You won't see the same one twice, and they find that really frustrating. And they hope that AI can maybe help them be a bit more empathetic by, if you aren't typing away on the computer and the AI is doing that, you can pay a bit more attention to the patient that's in front of you, and the AI can ping up, oh, you can't prescribe that because this person has this need, and they can just make them think of a person more as a whole. And that was a really, really strong theme. So
Just having the AI kind of almost like a second opinion in the room, like rather than being the primary mechanism you interact with somebody, but listening in the background to provide tips and pointers. Because it is hard, isn't it? I mean, GPs, I don't know how we expect them to know everything about every new technology, every new medication, every drug interaction and the problems that might occur with those. I mean, the systems will flag that, but having an AI tool listen in and then flag, oh, here are some things you might want to consider before the patient leaves would be great.
Yeah, that's kind of like a
Coming up with
safety
ideas,
net,
hopefully.
but also terrifying. Like, we need to check that it's safe, of course. But potentially that's what people
absolutely.
want. They don't want the AI to replace a doctor. They want to help the doctor treat them more like a person. That's what people are hoping.
We've had 2 podcasts on this recently. We had the Gates Foundation one where we looked at the AI, the agentic AIs that they're building into the Alzheimer's disease platform, and also one on XR and spatial technologies with some of the people from GBHI that came along to talk about their use of tech. Do go check those podcasts out. They're in Apple Podcasts and on our YouTube channel. Right, we've still got more questions. Having completed the fellowship, what would you now prioritize as your urgent research question? Effectiveness, cost effectiveness, or implementation, or equity and access, or ethics? You can only pick one. Can't pick all of them because I know you want all
of them. That is tough. I think what I'm most interested in personally that I took away from it is I want to know how robots can fit into care and what that looks like. What are people? So I guess it is sort of ethics, but it's also implementation. I want to know what people are worried about. I want to know because it's not real yet. It's not ready yet. We need to inform the lived experience perspective from the offset so it can be designed with that in mind rather than in when it is ready we have to then try and make it fit people with dementia. I want to see how people interact with AI's already here. People are already using LLMs. I'm kind of scared for people that are already confused or already maybe have delusions. Does AI make that worse? Is that safe for them to be using? Does it help them? These are all questions that I have, and I'd love to look into. If someone gives me some funding.
And at least for the next decade, you'd expect that I think within 10 years, we're going to have a population of older people that are a little bit more accepting of new technologies and have probably got things like Wi-Fi in their homes and things. But I think we're still a decade away from that point. I mean, I've got an elderly relative that turns the router off at nighttime because they're worried somebody's going to steal their personal details. They don't do online banking. They don't do any of these things. And these are people who are in their they're not super old. They're in their late 60s, early 70s. So until then, the technology is also going to be. Sorry?
They let their routers sleep at night.
I don't know. I don't know what they think is going to happen overnight, but for a while it feels like some of these technologies also have to be standalone. I don't know if you came across many that were I know things like the smart socks have got SIM cards in them and stuff to enable them to work in those environments. How you find have technology? I remember when I started working with care homes on the Enrich project that I started like 15 years ago now. Care homes were struggling with technology. They didn't all have Wi-Fi. In fact, sometimes they only had one computer in the building. Have care homes caught up with tech? Are they all a bit more switched on nowadays?
It depends on the place, right? But you've touched on the problem that tech can't solve everything because it is a massive burden on having the day-to-day use of that for the staff. They have to learn how to use it, and in reality it might just be more of a burden than a help. I saw a very techie care home, and then I saw one that was really low tech, but they had really high standard of care, because those people were focused on face-to-face interaction. But there's no right way of doing it.
No, and you can't assume, but it does mean that I think even I think quite often tech companies and startups that don't do good community engagement are often surprised when they suddenly realize that the places where they want their technology to be used are nowhere near ready or capable to actually deliver on that, which I'm finding. I mean, and I guess that's even worse in other parts of the world.
Yeah, co-creation,
Than the UK.
co-creation, co-creation.
Let's rush through some of
Okay.
these questions. We're already over time.
Yeah.
The curb cut effect showed. I'm not sure what I don't know what the
I
curb
don't
cut
know what that
effect
is.
is. Thank you, Pam. It's a new term. The curb cut effect has shown that adoption rates of assistive tech in general public drives down costs. Do you think this could be the same for robotics?
Yeah, so the more people that buy it at a larger scale, then it becomes cheaper to produce. Yeah. One day,
Yeah.
one day, if everyone has a smartphone like now, when that iPhone first came out, like most people didn't have one, and then it was prohibitively expensive. Now everyone has a smartphone, so one day it might be the same. Like everyone has a robot. It's just part of. Everyone has a refrigerator. Everyone has a robot.
I can't find the question somewhere in here. There was somebody made the point about potentially exploring things like leasing this, because also as well, you don't want to go spending £4,000, £5,000, £6,000 on a robot where I don't know what it is these days. Average life expectancy post-diagnosis of dementia used to be 5 years. I think it's a bit longer now. If you don't need that robot until you're in the last 18 months of life, you don't want to be spending no amount of money, should be off limits, but being able to sell those on, have a second-hand market or a way to lease them, possibly.
Yeah, no, for sure.
Okay. So let's take John asks, is there software available for VR in the UK? Do you aware of any existing software that could be used?
Yeah, I mean, if you just get a Meta glasses or what have you, what's it called? Oh, I've gone blank.
Yeah.
Oculus.
Yeah.
Oculus. Like they've just got an app store that you can, depending on what you need to do, you can get games or like not that I recommend it, but like VR chat. Like I was thinking it would be really great if we could have like VR support groups. So you can have that anonymity and be in a relaxing beach place and connect with people.
Yeah.
I think there's
in the metaverse.
Yeah, I don't know. No, this is not an endorsement because I don't know if places are safe and like they have good moderation and stuff. But yeah, it should be, it's very available.
I was trying to we did a podcast on young carers recently, and they were looking at how to support young carers. And I was trying to persuade them that they should look at like the community side of gaming, where you can potentially create, gaming rooms and get people who play the same game together, because that's where people will talk to each other while you're playing a game, and it takes some of the pressure off to say, oh, we're here to talk about caring for my mum, but they'll come together and play a video game and put people in a room and see what happens.
Breaks the ice.
Absolutely. Great presentation. We're seeing a growing trend in co-production as set out in our TAPI project. What evidence of co-design is there from product development to service delivery? I guess this is did you see a lot of co-design and, in your tour?
Yeah, so I keep going on about it, but at the Elderly Resource Centre, they had a living lab where they co-created like lots of projects, and they were bringing in industry and people with lived experience. So that was great. In Japan, I didn't get to go there, but in Nagoya, they have a gerontology center where they have a living lab as well. So I don't know how much it's used like across the industry, but yeah, in Japan and Hong Kong, they're totally on board with co-production like we are here. So fingers crossed, things will be more co-produced.
We're going to have to be a little bit selective in our last few. Excellent presentation. Do you think assistive tech will be alternative support in dementia care for family members and health and social care? Well, I think you've answered that question previously. I mean, you don't think it can replace it, but it can supplement and help where.
Yeah, take a little bit of the edge off. Like an AI, like I was thinking with Sota, the little robot friend. He's infinitely patient. Like if you need to leave the room and run an errand, and then your person you're looking after is like really distressed, doesn't matter if they ask, "Where am I? This isn't my home," a million times. Your carer is going to eventually run out of patience and be a bit more snappy, but the robot will be like, "No, this is your home, and you're fine, and you're safe. And do you need any help?" Like I could see that if you need to take a step away for a second, because that's reality. People do get upset and stressed.
Yeah.
Let the robot take the wheel for a little bit. That sounds bad, but you know what I mean.
You could, and that feels like that's something you could potentially do now. I mean, wouldn't be so hard to do right now. I mean, Apple's just added the ability for us to chat to AI agents while we're driving using Apple CarPlay and have conversation. You can have a whole conversation if you want. It doesn't have to be a
Focus on the
request. You can,
road.
just somebody to talk to while you're driving along, to make you feel less lonely. And you don't have to rely upon goodness only knows what, because you can train AI agents specifically on content that you give it. So don't learn from the internet, learn from what I give you. In fact, we've done that with Dementia Researcher. We've got an AI agent that's just got access to all the content on our website. So I know that I can trust the answers that it provides. And it'll still give it back to me in the voice of Yoda if I want. So that's always good. Right, let's move along. There's a bunch in the chat as well. Would you consider collaborative approach with those sensor robots? With the sensory robots be possible for a UK pilot study?
Yeah, girl.
If you're up for it to collaborate, Vishali, I think get in touch with Bethany and follow her on YouTube, and I'm sure she will accept that. Let me have a quick look in the chat.
Also a Churchill Fellow.
Oh, I see. Well, actually, do you know what? Annoyingly, we haven't really had time. We haven't talked at all about your Churchill Fellowship. How did you, tell me, how did you come across it? What would be your tips for anybody else or who was thinking about applying, just briefly?
So I feel like you asked the question because you already know, but I saw it advertised on Dementia Researcher. So
Really?
always helpful.
Well, and we learned about it. We had somebody, what's her name, who does the ethics work from Wales, did it last year as well, the previous one. Oh, she's going to be so annoying. I'm so rude. I can't remember her name. Carry on. Answer the question.
Yeah, no, I saw it advertised on Dementia Researcher, and every year they have certain themes. So like I joined the Tech for All theme, and so did Vaishali, and you pitch a project about something a different country is doing better than we are in the UK, and talk about how you'd like to go there and learn from what they're doing, and bring that knowledge back to the UK. And yeah, I was lucky enough to get on first try, but it's just a one time. Everyone the only eligibility criteria is that you're a British citizen, and you can only do it one time. So whatever you're passionate about, you don't have to be an expert in the topic either. It's just something you feel really passionate about, and they'll hopefully give you a chance. I think they've just announced this year's scholars, so I think you might have to wait a little bit for the application. I'm not sure, but look into it. I recommend it to literally anyone.
That's a great opportunity to get involved. And the person I was thinking of was Victoria Shepherd, from Cardiff University, who did that. Let me have a little browse through the chat here. So we've got somebody who's talking about Clive's got a recommendation on a tech company there. Somebody else has got some sharing lots of resources and links in there. There is work on regulatory standards and good practice in the housing space. Lots of compliments on giving a great presentation, Bethany, so well done. Of course, we also got, I don't know if you collaborate or connect with them, but there's somebody's a good reminder, Ying Lee, there about the health technology, the Care and Technology Centre at the UK DRI, of course, which is in Surrey and Imperial and things there, which is a good place to look up and connect with. and some talking about different presentations. But yeah, lots of compliments in there. Advancing in tech would not be better. Yes. Oh, that's where Prem. It was Prem who mentioned about the potential for leasing. Thank you, Prem. Wonderful. Well, we ran over time, but that's because this is one of the most fantastic sessions, and because I intervened with some of my own questions this week, because I love tech. I'm a big tech nerd. Any kind of new tech that comes out, and I love the potential for this to help people. So thank you so much, Bethany, for coming along today and sharing your findings with us. For those who don't know, this is our penultimate one of this season, but we are going to be back next Wednesday with one very last, and it overlaps with the last day of AAIC as well, so I'm very conscious that might have a bit of an impact. But we've got Dahi Clayton and Claudio De Rito from UCL, who are going to be joining us to talk about queer minds mattering, dementia, identity, and politics of being seen. So we're going to finish out the season on a high, and then we're going to be back in the first week of September after our summer break, where I'm going to go away and make use of some of the technology that I've acquired over the last few months. Thank you very much, the incredible Bethany Linder. You were wonderful, and we'll see you all next week in the Dementia Researcher Salon. Thank you. Goodbye.
Thank you.
Bye.